critical colon cancer symptoms you should never ignore. Colon cancer rates are climbing rapidly, not just among older adults, but increasingly among younger individuals as well, which is deeply concerning. What's driving this trend, and how can we take steps to protect our health? Today, we'll dive into these pressing questions, explore the key symptoms of colon cancer that should never be ignored, and discuss dietary choices that support colon health. Stay tuned as we cover these essential insights for your well-being. Tumors in the colon often grow in a disorganized way, causing internal bleeding that's not immediately visible. One effective early detection method involves analyzing stool samples for hidden blood. A stool sample is sent to a lab to check for any trace amounts. Another powerful tool is a colonoscopy, which can detect growths before symptoms worsen. Chronic bleeding can also lead to iron deficiency anemia. And if you're around 45 or 50 years old and notice pallor along with anemia, it's essential to be evaluated for a potential intestinal tumor. Tumors on the left side of the colon tend to cause symptoms sooner due to the solid state of stool, which leads to more frequent obstructions. Symptoms include a change in bowel habits. If you're used to a regular routine, but now experience long stretches without a bowel movement or increased constipation, it's a red flag. Stool shape may also become thinner as it passes through the affected area, or you may notice alternating episodes of diarrhea and constipation. Advanced tumors often appear on an X-ray with a distinct apple core shape, showing where the tumor has narrowed the intestinal lumen and made it difficult for stool to pass. At this stage, bright red blood or darkened stool from bleeding may become visible. Additional symptoms may include abdominal pain, gas, bloating, weight loss, fatigue, and, if the cancer spreads, liver pain or shortness of breath. Understanding these symptoms, along with methods for early detection and natural prevention strategies, is crucial in the fight against colon cancer. Intestinal polyps are typically benign growths that form as small, appendage-like tumors on the walls of the intestine, often without causing any symptoms. The most effective way to detect and address polyps is through a colonoscopy, which allows for direct visualization and immediate removal. Once removed, the polyp can be sent to a lab to determine whether it is benign or malignant. However, it's important to note that a small percentage of benign polyps can eventually transform into cancer, making early detection and removal essential in preventing potential complications. Additionally, a colonoscopy is a crucial medical procedure for the early detection of colon cancer. During the procedure, a long, flexible tube with a camera at its tip is inserted into the intestine through the anal region, allowing doctors to carefully examine the entire length of the intestine for any abnormalities, including polyps, tumors, or lesions. If a polyp is detected, it can be immediately removed and sent to a lab to determine whether it is benign or malignant. To ensure patient comfort, the procedure is typically performed under sedation or mild anesthesia, so most patients experience no discomfort and often have no memory of the procedure. Routine colonoscopies are generally recommended beginning at age 45 or 50, but individuals with a family history of cancer may need to start earlier. Follow-up procedures are usually scheduled every 10 years, unless more frequent screenings are advised by a healthcare provider. Several factors can accelerate a polyp's progression to cancer, with ultra-processed foods and excessive consumption of red meats, particularly processed varieties like sausages, salami, and ham, being some of the primary culprits. Unhealthy fats and high amounts of vegetable oils, excluding healthier options like olive oil, along with sugar and excess sodium, contribute significantly to this transformation. When these products, especially ultra-processed foods, are consumed regularly, they act like fuel for tumor growth. Ultra-processed foods have even been officially classified as carcinogenic, Other contributing factors include chronic constipation, an imbalanced intestinal microbiota, and persistent inflammation. Lifestyle choices like alcohol consumption and smoking are also well-established carcinogens that can further increase cancer risk. Understanding and addressing these factors can be crucial in slowing or preventing the malignant transformation of polyps. Our dietary choices, from what we pick at the supermarket to how we prepare our meals, play a vital role in preventing colon cancer. A balanced diet, combined with other healthy lifestyle habits, can even influence gene expression. Specifically, genes linked to chronic inflammation, obesity, dementia, heart disease, and cancer can become less active with healthier choices. In contrast, poor dietary habits and an unhealthy lifestyle can accelerate these same genes, potentially speeding up the transformation of a polyp into a tumor over time. To reduce colon cancer risk, focus on a diet rich in anti-inflammatory and antioxidant foods. This means daily servings of colorful fruits and vegetables, and spices like turmeric for their antioxidant and anti-inflammatory benefits. Healthy fats, such as omega-3s found in fish, like salmon, tuna, and sardines, and plant-based sources like chia, flaxseed, and sesame are also beneficial. Free-range eggs provide additional sources of good fats. Addressing constipation by consuming enough water and fiber can improve intestinal health, as can maintaining good sleep, regular exercise, and increasing social connections, all of which have anti-inflammatory effects. Nuts and seeds, including pumpkin seeds, are particularly beneficial for intestinal health. We'll dive into 3 types of foods that should be consumed in moderation, as they pose potential risks to the digestive tract and may even increase the likelihood of colorectal cancer. 1. Spicy foods. While spicy foods are a favorite for many, they come with a warning from health experts. Excessive intake can be harmful to the gut. Regular consumption of spicy foods raises levels of harmful compounds like nitrite and oxalic acid, increasing cancer risk. Spicy foods can also irritate the intestines, overburden them, and potentially lead to diarrhea or even colorectal cancer. 2. Fried foods. Although fried foods are popular, they also come with significant risks for gut health. For instance, when meat is cooked at high temperatures, proteins and amino acids can undergo chemical reactions that form mutagenic and carcinogenic compounds. Fried foods may taste delicious, but consuming them in excess can increase your risk of gut issues. 3. Grilled foods. Grilled meats are another beloved favorite, but overconsumption may heighten cancer risk. The high protein content in meats can produce carcinogens like benzopyrene and heterocyclic amines when exposed to high heat. Regular intake of these foods doesn't just pose risks for colorectal cancer, but may also contribute to liver and esophageal cancers. We hope you found this information helpful. Please share this video with friends and family to help raise awareness of crucial cancer symptoms that should never be overlooked. And don't forget to hit the like button and subscribe to our channel.